Welcome everybody to our quarterly March meeting for the Calgary Ostomy Society. My name is Pat Simic. I'm the president of the chapter. So we appreciate everybody signing in to join us tonight for our presentation with our couple of NSWOC nurses from the Foothills Hospital. I'm still trying to train my brain to say NSWOC instead of ET. Those of us who've had our ostomies for a long time, we're used to saying enterostomal therapists, but these two wonderful people are nurses specializing in wound and ostomy continence. So first part of our program is going to be a presentation by Chua. I hope I pronounced that right, Andy. And then Jessica Damm will be doing the question and answer portion of the evening. So Andy, without further ado, when you're ready to proceed, by all means, get started.
First of all, thank you for giving me such a great opportunity to share my information with you guys. My name is Andy. I'm an NSWOC and I practice in Foothills Medical Center. I've been asked to provide some information about ostomy products that can help prevent or manage peristomal skin problems. So I thought I would want to identify 5 common problems, which surprisingly a lot of patients think that they are normal, but they're actually issues that can affect quality of life. And I thought I would just want to share with you guys in terms of strategies, management on how you can prevent this problem with different products. So at the end of the presentation, I hope that you guys can at least identify 3 common peristomal skin problems and describe 3 strategies that can help to prevent these problems. Also to be able to distinguish different types of ostomy products that can help promote your peristomal skin health. And hopefully also I'm able to identify 1 product that you are willing to try to help promote your peristomal skin health. So I do not have any conflict of interest, neither do I represent my employer or any companies identified in this presentation. This presentation, it's meant to let ostomate being aware about peristomal skin problem. It is not to have you guys diagnose yourself. Of course, any suggested recommendation and treatment shall be done under the direction of an NSWOC or physician. So just some information about skin and ostomy. Our skin is actually the largest organ of our body. Its purpose is to act as a first line of defense for injury and inflammation. Our skin perspires to regulate body temperature, and therefore it is very important to have our ostomy products help manage such moisture on our skin. The pH of our skin is actually acidic in nature. This is the reason that the defense mechanism to help to protect from microorganisms. Our urine and feces, they are alkaline in nature. What it means is that if you have any effluent leakages, this content can alter the pH of our skin and therefore allow our skin to be damaged. The more liquid the feces is, the more alkaline it is, and the more enzymes they contain, and these can actually cause skin irritation. And why do we need healthy skin? If we got good healthy skin, we get better wear time for our ostomy products, and the wear time is consistent as well, so there's less chance of leakages. So this is the 5 most common skin problems that I've seen in my clinic. Medical adhesive related injury, irritant dermatitis, fungal infections, folliculitis, and granulomas. So here are the tips that I often adopt in managing a skin problem. I think it's very important to identify the problem and not just correct the issue. So how do you identify the problem is you will assess and inspect your skin every time you do a change. And also take a look at the back of the pouching system because it gives you clue on how you can troubleshoot your problem. Next, you need to treat the skin. And many times we always think that more is better, but for ostomy, I adopt the philosophy that less is more, because sometimes the more product you put on your skin, it actually affects the seal of your appliance. And I would make small little changes rather than changing the entire pouching system. What is medical adhesive related skin injury? This skin injury is usually caused by adhesive product. It usually presents itself as blistering or skin tear, and it's very painful. It feels stinging. It is caused by traumatic removal of ostomy appliance. And sometimes if you overstretch your the tape onto your skin, this can cause a disruption of integrity between the layers of skin and therefore resulting in an injury. And if you're using inappropriate tapes or bonding agent, this can cause injury as well. So to prevent this problem, I would encourage client to remove the pouching system in a gentle manner. And if you need the adhesive removal, it's a good tool to help to facilitate the painful removing process, because sometimes the wax ring or the material can be very hard, difficult to peel off. So the adhesive removal can help to facilitate. Avoid stretching the tape onto the skin. And if you notice that your skin is more fragile, and what you can do is that you can apply liquid skin barrier, also known as Kevlon as one of the brand, but many companies do have their own brand. So this liquid skin barrier should go onto the skin where the tape is going to stay on. So as you peel off that barrier, the next time you do a change, you're actually peeling off that liquid skin rather than your own skin. And instead of medical tapes such as waterproof tape, MeFix, the ostomy companies, they actually does have flange or barrier extenders that are much more compatible and friendly to your skin. To treat the blistering or skin tear, you can use ostomy powder and the liquid skin barrier to heal the wound. This is known as the crusting technique, and I would explain a little bit more on the later slides. Okay, I would say irritant dermatitis is the most common skin problem that a lot of patients will experience, especially if they have an ileostomy or urostomy. So this irritant dermatitis is actually caused by prolonged exposure to an irritant such as your fecal or urine content. Remember, I mentioned our skin pH is actually acidic, and the fecal and urine alkalotic state can actually alter the pH of our skin and cause it to be prone to injuries. Not only fecal and urine content, sometimes chemical agents such as adhesive removal can cause dermatitis as well. And it usually present in the sense that the skin is red and weepy. It can be very painful with a sensation of burning or stinging. So we first need to identify the problem, which is to assess your skin and also the barrier, the back of the barrier, because that would tells you where the leakage happened and when it's due for a change. So from the photo of the slide, you can see that this is the back of the skin. The back of the skin barrier is actually compromised with stool. So days like that, it tells me that the ostomy product has to be changed slightly earlier. So if this is a day 4 or day 5, I would encourage the pouching system to be changed a day in advance. And if you are using adhesive removal, you want to kind of wipe it clean and make sure there's no the residue of that chemical on your skin before you put a new pouching system on. Do not use soap to clean your skin because the soap can actually alter the pH of our skin. And commercial wipes, I will not encourage as well, because some of these products will not be compatible with ostomy product and they can compromise the seal. Of course, before putting a pouching system on, we need to make sure our skin is clean and dry. And with irritant dermatitis, we manage with ostomy powder and liquid skin barrier known as the crusting technique. And this is how we perform the crusting technique. So first, make sure the skin is dry, and then apply some of the ostomy powder onto the irritated area. The next step is that you want to take a dry towel to wipe off excess powder. then you can cross it with a liquid skin barrier. Sometimes it comes in a bottle of a spray. If not, it comes in small little pads, and you could use that pad to kind of dab on the powdered area. I do not encourage you to rub, because sometimes when you rub, you're actually rubbing off the powder. And then let the liquid skin barrier dry. Once it's dry, usually I would encourage client to do the first layer. And during the next change, if you feel like your skin is not improving, then you can actually perform multiple crusting layer 2 or 3 times as desired. But again, less is more, so I'll start with less first. So if you do have skin folds or crease, I would actually suggest to fill up these crease and fold with skin barrier fillers such as ring, strip paste, or sheets. So from the photo, you can see that there's a skin crease over at the 3 and 9 o'clock position of the stoma. So that area, I would maybe tear a piece of the strip paste over and fill it up. And in addition, I will use a skin barriering around the stoma. And another technique I find it helpful is before you put the skin barrier filler on, you want to kind of use your hand to kind of stretch the skin. When you do that, you're actually trying to flatten the creases so that the skin barrier product can stay better on the skin rather than having a pocket of air, which can allow fecal effluent to leak into. Resizing stoma is very important as well, because if the skin barrier opening is too snug or tight, and when it sits onto your stoma, our stoma actually produce mucus, and this mucus can affect the seal of the appliance and therefore cause a leak. So always cut your skin barrier about 1 to 2 millimeters bigger than your stoma. And the other option I would recommend is consider a pouching system that provides convexity or extended wear, especially if you have short guard or you have an ileostomy or urostomy, then extended wear would be recommended because they are more resistive to those corrosive effluent. What is convexity? Convexity, skin barrier actually provides a degree of curvature to your peristoma plane. So there are different characteristics of convexity, and every company has their own unique feature. So these 5 characteristics are the depth of the convexity and how compressible the skin barrier is. And we also talk about flexibility and the tension where the convexity can apply over, and also the degree of the slope. To sum it up, so convexity actually comes in a couple form. It comes in soft, light, and deep. So every company is slightly different. I think the most important thing is speak to your NSWOC. They would be able to recommend the right convexity for your ostomy. And why do I recommend convexity? Because convexity can help to flatten the crease or the folds, and it can make your stoma protrude more. And sometimes if the opening of the stoma, it's tipped towards close to the skin, the convexity can help to centralize that hole. Convexity comes in a form of the base plate, or if you're using a flat base plate, you can add a convex ring or convex inserts. So how it works is that if you have a stoma on the photo as shown in the diagram, so fecal and urine effluent is likely to leak over at the 3 and 9 o'clock position of the stoma, which is the immediate left and right. So with convexity, what happens is that it stretches your skin and flattens the crease, and therefore there's a less room for fecal or urine effluent to seep through. And if you have a lumen that is tipped towards the side, so in the diagram, you can see the lumen is tipped towards the 3 o'clock position of the stoma. So sometimes when you put on a convexity, it can help to align and centralize the opening of the stoma. So on the other side of the diagram, you can see that if the lumen is actually sitting on close to the skin, what happens is that poop or feces tends to leak through underneath the skin barrier. So when you put a convexity on, it can help to pull up the stoma and anchor the hole, so the urine and fecal effluent can be directed into the pouching system rather than underneath the barrier. If you have a flushed or retracted stoma, so again, this gives the opportunity for the stool and the urine to kind of sit underneath or pull around the area. So if you add a convexity to your ostomy, what happens is that it helps to add a bit of pressure around the stoma and allows the stoma to protrude more. So when the stoma protrudes more, it's like fecal and urine effluent is likely to be directed into the pouching system rather than underneath the barrier. So earlier I mentioned extended wear. So what is the difference between extended wear and regular wear? Extended wear usually lasts longer than the regular wear because they have better adherence, and because of the content used on the skin barrier, it is much more resistant to breaking down from those corrosive effluents such as the ileostomy or urostomy output. And the skin barrier itself holds more moisture and therefore help to prevent a lot of skin problem. And I mentioned earlier that extended wear is highly recommended if you have an ileostomy, urostomy, or if you are somebody who is very physically active and you tend to perspire more, or you would like to have, long showers and such. So this would be an ideal product for you. Fungal infection is the second most common problem we see in our clinic, especially when the weather starts warming up. People are getting more physically active, and the temperature gets warm and hot. And why is this so? It's because Candida, it's also known as a yeast infection. So Candida are microbes that can be found on our skin and gut. So they like to grow in moist and warm area. So that kind of explains if you engage more physical activity or during summer, you are more prone to get fungal infection. And these Candida often attack the ostomy when they are the most vulnerable, especially if they're receiving any antibiotics, steroids, chemotherapy, or if you're diabetic or immunocompromised, you are high risk of getting fungal infection. And it is usually present in the form of raised red satellite lesions. So they kind of spread around and it's very itchy. Sometimes it can be burning or stinging as well. So how do we deal with fungal infection? First is we reduce moisture. So how do we reduce moisture? We want to dry the pouching system after shower or bath, especially if your ostomy product has cloth-like material, they can trap a bit of moisture. So if that happens, you can try dry them up. If not, you can protect those material with flange or barrier extenders. So convexity and extended wear, which I mentioned earlier, they can reduce moisture on the skin to a certain extent. So that can also help to manage this fungal infection. So when you see such rash, speak to your physician or NSWOC. They will write a prescription for you for a topical anti-fungal powder, which will use it on the skin. And we use the also the same crusting technique as we use on ostomy powder. And I would usually suggest to treat the skin when the rash has resolved for another 10 to 14 days. So crusting technique part 2. So not only ostomy powder, we can actually use the crusting technique on other topical agent, depending on what is the problem. So of course, if you have a yeast infection, we use a nystatin powder. Okay, if you have a irritant dermatitis, you could use a calamine lotion. So what happens is that when you get a bottle of calamine lotion, you want to pour away the top water content, and what's left behind the bottle is a sludge. So you can use a bit of sludge on the irritated skin. So calamine is actually has an astringent property. What it means that this calamine can help the weepy skin to dry up a little, and calamine contains zinc and can help the skin to heal better. If you have an allergy or very severe dermatitis, your physician and NSWOC might prescribe you a Flovan that is to be used topically on your skin. And sometimes we do use antimicrobial as well, and antimicrobial powder as well. So if you're crusting with medication, always do the medication first before you add your ostomy powder and the liquid skin barrier. And again, the same theory apply, less is more. I'll do one layer, and then the next change, I'll see if there's any result. If it's not too effective, I would repeat 2 layers for such treatment. The fourth problem that we see in our clinic is folliculitis. Folliculitis is defined as inflammation of the hair follicles and is usually caused from traumatic injury to hair follicles or infection. So if you remove your pouching system in a traumatic manner, that can cause some folliculitis. And sometimes if you are shaving your skin in a multi-directional manner, that can also cause folliculitis. So the clinical manifestation for folliculitis are redness around hair follicles. Okay, and sometimes it can present with pus. It is usually very painful and tender to touch. To prevent this, I would shave along the direction of the hair growth instead of against the direction, because that reduces the trauma to the hair follicle. And I will keep shaving minimal, shave only if you have to, because the more you shave, the more chance that you're gonna, cause injury to the hair follicles. If you have an option to use electrical clipper versus a razor, I would choose an electrical clipper, because razors sometimes they harbor microorganisms, and when you shave, you might nick yourself and introduce those microbes onto your skin. I would not recommend any shaving products on your peristomal skin. What you can do for shaving is that you can use ostomy or baby powder and do a dry shave. It works better that way. And if your folliculitis is very severe, we will treat it with antibacterial soap and do a good wash every time you do a change. The inflammation, we can also treat it with antibiotic gel or antimicrobial powder, which I mentioned earlier. The last common problem that we often see in the clinic is called granulomas. What are granulomas? Granulomas are raised red bumps that can be usually found along the edges between the stoma and the skin. This is caused by chronic inflammation from either an embedded suture, or sometimes there's too much friction or moisture that can kind of stimulate that chronic inflammation. So these red bumps that is shown on the photo, they usually bleed easily when you touch. So if you're just trying to clean your stoma, you notice that it just start dripping out blood. Sometimes this granuloma can be quite tender. So if you do have granuloma, you need to speak to an NSWOC or physician. They will help you to do a thorough assessment to make sure you don't have any retained sutures. And they will manage your granulomas with topical silver nitrate sticks. And they will do it every time you do a change until it resolves. So for the junction between the stoma and the skin, we can use a bit of ostomy powder to help to manage the moisture. So earlier I mentioned one of the reasons that can cause a granuloma is friction. So if you are cutting your skin barrier too small, they can rub onto the mucosa tissue and cause granuloma. And also, of course, if your barrier opening is too small, again, I mentioned there's a high chance of leakages and there's a lot of moisture underneath the skin, and that can kind of cause granulomas. And also I mentioned about is ostomy appliance. I would prefer a product that has convexity because they can reduce the moisture around the stoma. So over the last couple of slides, I have introduced a variety of ostomy products that can help to manage your peristomal skin. I talk about convexity, and it comes in soft, light, and deep. Okay, you can have an option of a convexity base plate or convex rings or insert. I also mentioned how extended wear can help client who has an ileostomy, urostomy, or client who are highly active, physically active. Okay, we also talk about crusting with ostomy powder and liquid skin barrier, and filling up skin creases with the barrier fillers. So this is how a flange or barrier extenders look like. They should go around the flange, and they can kind of increase and help with the seal in that sense, especially sometimes if your edges of the tape keeps peeling, this can help to hold it down and keep that area free from moisture. The other two things that I have not talked about is belt and binder, especially if you have a retracted stoma or you have a much firmer abdomen. What happens is that if you use a convexity, your abdomen will kind of fight with the convexity and cause it to dislodge. So if you put a belt and a binder on, it can hold the appliance better and prevent a leak. So over the next few slides, I am going to identify a few of my favorite products from different companies. So for Hollister, I think what is noteworthy is their Ceraplast product because they are infused with ceramides. So ceramides are actually waxy fat molecules that can be found on our skin. So these molecules actually creates a barrier and help maintain hydration in our skin. So when that happens, your skin has stronger integrity and less chance of breaking down. So the Ceraplast product can prevent dryness because the product are infused with ceramides. So, and especially when you have to peel off the ostomy appliance every couple of days, you might be peeling off the ceramides, the natural ceramides that is found on your skin. Sometimes you can also peel off the top layer of your skin. So with this Ceraplast product, they can introduce ceramide onto your skin and prevent dryness. And therefore, you would feel less itchy. Sometimes I have a client who has perfectly intact skin, no rash, no dermatitis, yet they still feel like the skin is very, very itchy. It's because it's lack of ceramide. And when they use this Ceraplast product, they find that it's actually helped a lot. And recently, the Hollister has launched their two-piece soft convex. So this is a new product that is launched. I'm going to show you from my camera. I hope you can see. So this is their regular barrier, and it's quite firm, and you can't really press it down. So, and this is the soft convex. It gives a convexity to your ostomy, yet it's much more flexible and softer. And the client actually feel that it's much more comfortable on their skin. Hollister also have their Flex 10 series as extended wear, and that's something that you guys could consider trying. So two products I've identified for Coloplast is the Brava Barrier Cream. So similarly to the Ceraplast product, but they work totally differently. The Brava Barrier Cream actually contains some moisturizer. It can help to soothe the sore, dry, and irritated skin. So if you feel like skin is itchy and you are not using a Ceraplast product, you can consider introducing this Brava Barrier Cream. Not only it can moisturize the skin, it can also protect the skin from the fecal or urine effluent. And also it creates a barrier to prevent any damage caused by the adhesive. And what's amazing is that not all kinds of cream is compatible to ostomy product, but this Brava Barrier Cream, it allows your ostomy appliance to stick on. So the technique for applying this barrier cream is that you want to apply a peanut size around and just smudge it around your peristomal skin and keep massaging around until you feel that the skin is no longer greasy, it becomes tacky, and that's when you can put your appliance down. So last year, Coloplast also launched their convex ring. So also on the video, I'll show you how the convex ring looks like. So what's amazing about this convex ring is that it is very soft. It gives a soft convexity to your skin, okay? And it's very stretchable. So if you have an oval stoma, you can just stretch, okay? And it doesn't coil back. It retains the shape, okay? And you see this in the screen, the flat side actually goes behind the skin barrier, whereas the curved side goes onto your skin, and that's how they create this soft kind of convexity. And it comes in 6 different sizes. So if you are not too sure which size you should get, you can speak to your NSWOC and they can guide you on which is a good fit for your stoma. So last but not least, Convatec. 2 things. Ekin ring, it's commonly known as Ekin ring. This is my go-to if my client has like skin breakdown, because I find that the Ekin ring actually it's highly absorbent, and it's not only highly absorbent, it's very quick in its absorption. So I did a kind of informal experiment, actually placed a couple of rings with the same amount of water. I noticed that actually the Ekin absorbed the water quicker. And what it means is that, you know, there's less chance that your the skin will be, you know, will trap moisture, because this ring can kind of absorb your perspiration. And I use it on a client that has very bad irritant dermatitis. It just healed the skin within 3 days. The other thing for Convatec is their moldable anti-adhesive technology skin barrier. So I know some of my clients, they don't like to cut because they just find it so cumbersome that they have to bring the scissors everywhere they go. So again, in my video, I'm going to show you this is how the barrier looks like. You can actually stretch the barrier according to the size of the stoma. And over time, the edges actually roll back. And when they roll back, they actually wrap nicely around the stoma. And it reduces the gap between, and it prevents leak in that sense. And the duroadhesive technology of this skin barrier makes the skin barrier very durable to corrosive effluent. So the big question is, what is the best product? So the answer is there's no best product, because every product has its own purpose. And every ostomy, it's a unique individual because of their abdominal topography, their lifestyle, their preference, and their habits. So the best product is actually the product that can fulfill your needs and is a good fit to your lifestyle. And sometimes it's not just you use one kind of system and can last you throughout, because everybody's lifestyle and preference change over time. So the important thing is being aware and being aware about these common issues, and always do a check and think about how have your lifestyle or your preference or your habit changed, and speak to an NSWOC and discuss and come up with a plan, and they can recommend you a product that can improve your quality of life. So I'm come to the end of my presentation. We have discussed and identified 5 common peristomal skin problems. We talk about strategies that can help to prevent or improve our skin issue. And we also discuss the variety of ostomy products as well. And I hope you had identified a product that you think that you might benefit and give it a try. So we encourage you to speak to an NSWOC. And these companies, they do have amazing sampling programs, such as Coloplast Care, the Convatec Me Plus services, and Hollister Secure Start services. They are usually very helpful and very generous in giving out supplies for you to try. And I would have one more tip for you guys. When you guys are trying something new, give yourself a 3-week period on a product. Okay, the reason being is that the first week, if you fail on that product, it doesn't mean that the product is not working, because you're not very familiar with how to use that product. So it's a learning curve. So the second week, you're kind of getting used to that product. And then the final week, then that's when you can evaluate if the product is beneficial to you or not. I want to give special acknowledgement to Calgary Ostomy Society. Thank you for giving me the opportunity to talk to you guys today. And also Tyler from Coloplast, Pete from Convatec, and Leslie from Hollister. Thank you for sponsoring the goodies for the participant in today's meeting. These are my references. And I'm going to hand over the Q&A session to Jessica. Thank you, everyone.
Thank you, Andy. Before we get started with Jessica, I forgot, or I was remiss in mentioning that you were very graciously provided some products and door prizes that we will be drawing for at the end of the evening. Tiffany has got everybody's name on our little spinning wheel, and we will be giving them a spin, and the winners will be chosen by that means. Andy indicated that the products won't be in until next week. So if you could just hang on at the end if you're a winner, and provide us with your contact information so we can get you the product when it does come in. So as Andy mentioned, I will turn it over to Jessica Damm, who is an NSWOC as well at the Foothills Hospital.
Hello. Welcome, everyone, and thank you, Andy, so much for that wonderful presentation. You did a very good job. Like they have mentioned, my name is Jessica Damm. I'm an NSWOC. Just one small correction. I do work out of the Peter Lougheed Center, not Foothills at in that NSWOC clinic, but
My apologies.
Oh, yeah, no worries. So yeah, I see that there is a couple of questions in the chat box. So I just thought I would start from the top there. The first question is, if you have a convex pouch, is it suggested to add a convex ring also, or are they incompatible? I don't have a lot of experience with the convex rings, but from what I've seen, typically you would trial one or the other. Andy, have you had any experience using both?
I guess it depends on what kind of a convex skin barrier that was used originally. So sometimes we do add a convex ring onto another soft convex skin barrier, but again, this is very individualized. It depends on how your stoma skin looks like, if you have any crease, and if your abdomen it's firmer or soft. So there's a variety of all these factors to consider. So I wouldn't say that it is entirely not compatible, but I would encourage you to speak to your NSWOC for a better assessment. Absolutely.
And while we were talking about that, do you know off the top of your head what the 6 sizes of the convex rings that come in Coloplast?
I cannot remember off my memory, but I think it comes in 25 millimeters, 20 millimeters, 30, 35. I think there are 60 as well, but I would encourage you guys to refer to the Coloplast website, and they would have measurements on their website. Yeah.
Perfect. Thank you for that. Okay. And thank you so much, Sharon, for your comment. I appreciate that. Okay, the next one is follow up to the question about the convex ring sizes. Are there different depths of convexity for the rings? I believe they come in the light, the soft, the light, and the deep as well. Is that correct, Andy?
So the light, soft, and deep, it's more of the skin barrier. With convex rings, usually it comes in one type of depth, if I were to put it in that sense. But every company, they design their rings slightly differently. I do find that Hollister convex ring, it's slightly firmer than the Coloplast one. So again, it depends on your abdominal topography. So you might benefit a firmer convex ring versus a softer one. So I would say, speak to your NSWOC, then they can guide you further.
Thank you once again for that. That was all the questions in the chat box. And I do want to apologize in advance. I am in my first year of practice and I am learning as well with you guys about all the products that are available out there. But I do welcome any other questions if there was at this time.
I have one. This is Pat. I noticed on one of your slides, Andy, you had the extended barriers on. Do you put those on the outside? I always thought they went on the underside of your skin and then you put your flange on top of it.
Andy, I can answer to that if you like. So I have seen, and like we've mentioned many times before, very individualized with each person. I have seen it be used on skin that's broken down and denuded and weeping. But typically I see it kind of used as an extender of that flange, as the name describes, and it typically helps extend the wear time of your barrier.
Okay.
So I think either or, and we just kind of, once again, you just work with your NSWOC to meet your needs.
Okay, thank you.
You're welcome.
Yeah, I just want to add a little bit more about that barrier. So remember I mentioned about some skin barrier, it comes with a tape. And if you don't like that tape to be sitting on your skin, you could do a barrier extender. And then when you put on the skin barrier on, the tape actually sits on the skin, on the flange extender, then rather than on your skin. And this can help with, those skin injuries. So there's no right or wrong way. It depends on what is the reason or the purpose. But of course, if you want to prevent the tape from trapping, or rather the cloth material from trapping moisture, then the barrier extender would do better in terms of covering that permeable material.
Okay.
Lovely. Thank you again, Andy. Okay, so in the chat box, I've had some issues with itch and red rash around the outside tape area. Have had good luck with a light cortisol cream, 1% or zinc cream, but it has to be removed and treated with the barrier spray or wipe. With that being said, there is other forms of getting that steroid. As we mentioned, there is the flow vent that can be used, which would not require you removing it the same as you would as an ointment. And for the zinc, was there any other recommendations you had, Andy?
I do see my mentor using ointment, and they do affect the seal of the skin barrier. So if this is something that your physician has prescribed you, or this is the only formula that is available, then yep, I would say that you can apply ointment or cream on your skin. I would give a good rub. I would probably rub for 3 to 5 minutes. And then after that, I would remove the entire ointment, because I think what's important is your skin has absorbed the medication. So after you rub it, do a good clean, and then you can put a pouching system on, and this would not compromise the seal. But I just kind of like to reinforce what Jessica has mentioned. It's better if we use a flow vent, because not everybody is comfortable in massaging the stoma for a long time, and then cleaning it off. It's much more cumbersome. Whereas some other medication, you just kind of spray on it and it's kind of instant.
Did that answer your question fully? Lovely. Okay, was there any other questions out there?
This is Lawrence. I'm just wondering, Andy, whether it would be possible to get a copy of your notes. There's a lot of useful information in there, and it'd be nice if I could get a copy of it somehow.
I'll just answer that here. I'm going to be posting this video on YouTube. We can also put the PowerPoint out to everybody. I have a copy of that. So whichever works better for you, but the YouTube video will hopefully be posted in a couple of days if I can get all the editing done.
Sounds good.
Okay, anybody else?
I have a question, which this kind of relates to an ad I saw in the newsletter, a new ad from Coloplast. Like on my stomach, I put on a lot of weight, and now I have a scar going down the middle and then along my pelvic bone. So it's kind of this lump. I don't think I have a hernia or anything though, but I've been using Convex for many years. And like Andy's picture, my stoma points out to one side more than the middle. And then I also have kind of a slight crease, not like a total dip, but just the between pulling on that scar and my stoma, I believe. So in the Coloplast ad, they had that star-shaped flange with the convex ring on it. And so I'm just kind of wondering, like, I noticed with my convexity on the flange, it will kind of like my stomach's like pushing it up away from my skin. And that's not really a humongous deal because that barrier, the Brava barrier ring is really strong. But I went swimming and it was like almost ready to fall off. So I'm just wondering if there would be a better option for me with that star-shaped one for my bump, but then the convex ring. Like, have you guys used that combination yet?
I have certainly used that appliance by Coloplast on herniated stomas. What you're describing kind of sounds like it is comparable to the abdominal plane that we might see with someone who's herniated. And I think that it would be worthy of you to talk to your NSWOC and maybe see what their thoughts are and see if you could be sized for one. I definitely think that's worthy of exploring.
Okay, great. I'll do that.
And I think that the Coloplast company actually did mention before that the convex ring it's compatible to the they call it the concave skin barrier, because many of times we see patient who has peristomal hernia, their stoma is usually kind of flush or retracted, and they do experience some leakages because of the nature of the peristomal plane and how retracted the stoma is. So the convex ring that is introduced by the Coloplast, they are very soft. So if you have a little bulge over that area, I think it might be worthy to try adding a convex ring with the concave skin barrier. Or if not, you can use a flat skin barrier as well. And it doesn't mean that if you use a Coloplast ring, you have to match it with a Coloplast product. So it's very customizable. You can be using a Convatec product and then match it like a ring, match it with a Hollister skin barrier. So of course, like the pouch and the skin barrier, they usually goes together. I wouldn't recommend you to try, matching them. But the other accessory, there's no harm. Like you can do a Coloplast paste with a Convatec product too.
Absolutely.
Okay, thank you.
Sorry, I do have one question in regards to those of us who have a little more of a belly. I find lately that because I have a bit of a skin protrusion, because I do wear a belt, I'm just going to switch my method. There, it's easier. with my belt, it just holds my flange in. It works great. I don't think that it's pulling the flange in too harsh, but I do find that my flange, I wear a 2-piece and the bag is separating from the ring on the bottom because my stomach sits there. So it's got like a shelf. And as soon as there's any product in my bag, I don't know if it's the weight or my stomach, but are there any appliances that have a stronger attachment, but 2-piece?
I wonder if she would benefit from that Coloplast product, the one that is far more malleable, the flange, and gives that convexity, but still able to fold a bit more into those abdominal folds. What are your thoughts on that, Andy?
Sorry, it's the bottom part. So if this is the ring and this is my head, feet, it is separating here from the ring. It's separating there.
Okay, and you're
So
using
the flange is fine. It's the bag itself. So are there any products that have a stronger attachment here?
Andy, could you speak to that? Because that locking mechanism would have been my first kind of thought.
Sorry, please.
Or-
You mean that
It's like somebody's ripping this off.
That's a product failure.
Yeah.
That's
Yes. Or is it I've got a chubby belly? That's why I'm
No,
asking if there's anything
product.
stronger.
Mhm. Yeah, I'm just wondering if you were to try another system. I think there's a flex system rather than a coupling mechanism. The flex system, they uses that adhesive. I wonder if that would solve that problem.
This is my third product. Opposed to trying new.
Yeah.
It's just, it's getting expensive.
Mhm.
Was that Pris, was that happening on all your other products you used as well, or was it just this one?
This was the one I switched to because I was using Hollister and I was burning through bags so fast.
Okay.
Okay. When is the last time you met an NSWOC for assessment?
I'm gonna say a year ago.
Okay,
But
I would.
a year to 18 months ago, because I was finding this to get quite cumbersome.
I would suggest you to speak to an NSWOC, and maybe they can help you because they can actually physically assess your stoma site and kind of troubleshoot from there.
Okay.
And the beauty of an NSWOC as well is they can help you with samples of different products, trial them before purchasing, or if you're getting your products through AADL. That way, they can help you trial things, and seeing that stoma and assessing it face to face and being able to kind of give you products to trial, I think what you would definitely benefit from. So I strongly encourage as well you to just touch base and do that face to face.
Thank you.
Yeah, you're welcome.
Even just within the last 12 months, there's actually quite a lot of new product that's launching from the company. So it might be worthy to try and mix and match to find out a system that fits your stoma.
Oh, there's, okay. Thank you.
Yeah.
You're welcome. Okay. There was one recommendation from one of our ostomates tonight. I have a belly too, and I use a 1-piece Sensa Mio Convex. And is that the system that you said you were in?
I use a 2-piece so that I can switch to a high output at night. But yes, otherwise the same product.
Otherwise the same product. Okay. And then also the Coloplast will send free samples to try as well. So that's something to do. But I still think going through an NSWOC and then just being able to kind of maybe guide you through some of those products that might be able to meet your needs would be good.
Certainly. Thank you again.
You're welcome.
Was that happening right from the get-go when you started using that, or is that just something that started recently?
That started once I gained weight and got my belly.
Okay. All right.
Unless I found like a binder or something that just tucked in that bit of belly that's pushing
Mhm.
on my bag, but I wouldn't even know what to go for that.
All right.
There is abdominal binders available out there. And once again, an NSWOC will be able to kind of guide you for manufacturers and sizing and stuff like that as well.
Oh.
And then I do strongly encourage as well, if there are kind of those different body changes, you've lost weight or you've gained weight, and if there's changes in your wear time, that is a great time to touch base with your NSWOC again and just talk about those changes and see if they can't help with those.
Excellent, thank you.
Oh, and I have one suggestion. If you're using a high output bag, I use that like all the time. I almost never use the other bag anymore because it's just so convenient. So I know that's like really long, but if it isn't causing that problem, it might be like a temporary solution.
So going back to that, Tiffany, how do you keep it? So I tend to, if I'm wearing it, I'll fold it up because I'm usually, as I said, wearing it to bed. There's the odd time where I'll just be lazy and leave it on when I go to the store. How do you keep it from sticking to your leg, to put it politely?
I guess wearing it kind of sideways a little, so it's kind of pressing more towards my hip. And
Okay.
sometimes I tuck the tail of it into the edge of my underwear just to kind of hold it in place.
Okay.
Rather than swinging around and, you know.
Chris, you might also want to angle it between your legs because then that distributes the weight as well. I've been wearing my pouches like that right from the get-go, and I wear a fairly long one as well. And if you've got it angled between your legs, that takes it doesn't flop around as much, and it doesn't hang, and it doesn't chafe, and it doesn't do that. At least not for me, it doesn't. So you might want to try that as well.
I'll definitely try that. I'll let you know how that works with my thighs.
Okay.
All excellent suggestions. Thank you.
Some products, they actually allow you to kind of fold up that spout and for you to tuck into within the pouch itself, so the spout won't be kind of digging onto your legs. That's an option too.
Absolutely. Thank you all for your input. This is actually my first meeting that I've attended, and I can see that this would be a great resource to kind of just bounce ideas off each other.
Well, that's what we're here for, with the purpose.
Yes.
Has anybody else got any other questions? Or any suggestions for people who are newer to this than some others?
Well, hi, it's Heather. I just want to mention that I purchased some of the underwear products from CUI Wear. I know there is a vendor here in Canada, but they charge the same for one as the CUI people charge for 3.
Okay.
So they bill you in pounds sterling because they're out of the UK. And I'll put the website in the chat. I've purchased support undies, the regular undies. They have like a pouch inside the underwear, so I just tuck the pouch in and it holds it up against your body. And also they have a beautiful swimsuit as well that has the little pocket.
Okay.
Well, it's not so little. It's a big pocket. So I'm just going to send that out.
Good.
Lovely, thank you.
Mm-hmm.
Very good. Thank you for sharing that link. Okay, any other pressing questions out there?
I'm also curious, is there any other topics that you guys are interested to learn, to know about ostomy? Would that be helpful? Because I know you guys in the past have dietitian or GI specialists to talk about high output and things like that. I mean, as an NSWOC, I was hoping if I can, help the support group, because it's so amazing to have you guys, and to have all the ostomate helping one another. And I just, like me and the other NSWOCs in Calgary, we thought we could kind of share our experience with you guys. So if there's any topics that you guys want to know, we are more than happy to come and meet again and talk about stuff.
Okay, thank you. That's great information. I'm sure that we've all got situations and things that we would like to know more about. I mean, just even talking now, and I've heard of them before. I don't know if what I'm using is a high output pouch, but I would be interested in that because I have short bowel syndrome. So it's a lot all the time. And I don't know what Pris and Tiffany, what product they use for that, or how big these pouches are, but that would be something I'd be curious to know about. So, or if the one I'm using it holds a lot anyway. So, but I'm just curious under what circumstances that you would recommend something like that. And if it's for day or night wear, so, or both, I guess.
Yeah, absolutely. Reach out to your NSWOC, try those samples, get in there and get tactile.
Yeah. Anybody have anything else? Okay. Well, thank you very much, Jessica and Andy. It's been wonderful having you. You've been very, very informative for us. And as Tiffany said, this presentation will go up on YouTube in a couple of days, or whenever she gets it web ready, or whatever the term is. Thank you so much for taking the time to spend it with us. And yeah, this is a great resource. You're all both welcome to our support group meetings, because there's always interesting situations that come up with that. And people have questions, especially newer ostomates, so and situations that they encounter. So you're more than welcome to join us on the 23rd of April, which is a Saturday. So do that. Unless there's any other questions or any comments or any suggestions for future programs, I guess we can bring this to a close. Thank you very much, everyone, for participating with us. Thank you, Tiffany, for doing your good job, and for Heather, and thank you for everybody else. It was a pleasure to meet you, and thanks, guys. And we'll be in touch through email whether we're going to do another webinar next month with what was it, the how to maintain exercise during COVID and conserving your energy. So two kind of opposite ends of the scale, but anyway, we're gonna try and work on another presentation for some time there, maybe early in May. Thanks, everyone. Have a good evening. Stay warm, stay healthy. Good night.
Thank you. Good night.
Right?